After a year of unprotected sex, if you're not using any protection and you've not had a pregnancy in for so long, always better to get investigated to see ki everything's fine. So I'll give you an example of a couple. 28-year-old, they were married for 7 years. They're like, we've never planned a pregnancy till now. So I said, great. So what contraception have we been using? They're like, कुछ नहीं. पर हम लोग ने कभी ना condom, ना कोई contraceptive pills या कुछ भी. It was very unlikely that if you're having regular sex for say 7 years or 3 to 5 years, बिना कोई contraception के कभी भी pregnancy scare भी नहीं हुआ है.
What are the tests or screenings you would recommend when they are planning a pregnancy?
There are some simple tests like your CBC, which basically tells you your hemoglobin, ki anemia hai ya nahi. India is the diabetes capital of the world. Indian women, especially when they're pregnant, have a 10 times risk of developing diabetes in their pregnancy as compared to our Western counterparts.
Right.
So we want to make sure that you're not diabetic beforehand or you're not at a risk of diabetes. Thyroid function is another thing that we tell all our female partners to do, because thyroid can cause irregular periods, heavy bleeding. It can even cause recurrent miscarriages. Okay. So that's something that we look into. And a couple of hormonal tests like your serum prolactin, because that's another test which can affect your ovulation, like how your egg is growing, and your AMH. Now this AMH report is what tells you ki ovaries mein kitna strength hai.